And then we're going to use active range of motion for general assessment of total range of motion. Okay, active assistive range of motion. What does that tell you? What do the words tell you? You're helping them do it a little bit, yeah. And so I might have strength to go to here if my therapist just gives me a little bit of, like if my therapist supports the weight of my arm, I've got the active ability to move it all the way through. So that's what we're talking about when we say active assistive. So it's not passive, it's not the therapist doing it for the patient, it's the therapist doing it with the patient, okay? So if you think of it as just carrying the weight of the limb so the patient can do more. And you can feel, you can feel that their muscles are contracting. And, you can feel that they're driving the motion. You're just giving them some support, okay? So that's what active assistive range of motion is. So it's assistance from an outside source to assist in holding the weight of the limb while the patient moves the joint through range of motion. AAROM, active assistive range of motion. Okay. And I know that y'all are being tortured with learning all sorts of abbreviations. And I gotta tell you something, the trend right now in documentation, especially with electronic documentation becoming more and more in place, is to move away from abbreviations at all. And so like the program that, I'm learning how to use at like outpatient, what we're doing is we're taking these abbreviations that we're all used to, putting them into a macro. So when I type AAROM, it types out the whole thing.
Wow. But also you have to make sure it's the right one.
Yeah. That's the struggle that we're having right now, because it's like somebody put in PT for patient,